by saying that I am delighted and honored to be here. I was really pleased that I was asked to be here for a number of reasons, but because I think the main reason for me is because mental health is an area that's often overlooked at these kinds of conferences. I've been fortunate to be at a number of plant-based nutrition conferences. I haven't really heard a lot of people talking about how plant-based nutrition impacts mental health. And then on the other side, when I've been to psychiatry conferences, then they don't really talk about nutrition. So it seems to me that this is an area where we need to intersect. And I think that a lot of people still have no awareness that nutrition is important for mental health. Right? We've heard a lot today, and I see a lot of people nodding. Yes, it's important for heart disease. Yes, it's important for the prevention of cancer and diabetes. But what about for our brain and the other organs that contribute to our mental health? So that's why we're going to discuss this for the next 30 minutes. Full disclosure, this presentation is usually an hour, so I'm going to try to do it in 30 minutes. So I took out all the graphs and stats and all that kind of stuff, which maybe for this time of day isn't so bad. I also don't have any pictures of fist-sized gangrenous wounds. You can decide Okay, so I work in London, Ontario at the Child Welfare Resource Institute. It's run through the Ministry of Children, Community and Social Services, primarily in the dual diagnosis program. So kids who have a diagnosis of an intellectual disability plus psychiatric or severe behavioral issues. And then I provide some telepsychiatry and work consulting for family health teams. And I have a fellowship in integrative medicine, which is through the University of Arizona. So that's kind of something that steered me more into looking at nutrition. I don't have anything to include. Okay, so the three kind of main points that I want to touch on in our Coles Notes version today is first, this idea that what is good for your health from the neck down, perhaps not so surprisingly, is also good for your health from the neck up. It seems evident, but it's not something that we've really talked about a lot in psychiatry. The middle section is talking a lot about inflammation, and you've already heard a lot about that. So looking at an inflammatory component in both the development and maintenance of mental illness. And then the last section, that would be medicine, talking about foods that have particular mental health promoting properties. Okay, first section. So the focus in psychiatry, at least when I was training, was on brain anatomy and brain physiology and on our genetic makeup. And I don't think anybody could possibly argue that these things aren't important in mental health, right? We know that they can affect our predisposition to certain illnesses, they contribute to their onset and maintenance. But that being said, if we focus too exclusively on just our brain anatomy or brain physiology, if we look at that in isolation, then I would say that gives us too narrow of a lens when we're looking at preventing and treating mental illness. So to illustrate this, I want to use depression as an example. So we know the risk of developing major depressive disorder has increased at least tenfold since World War II. The World Health Organization predicts that by 2030, more people worldwide will be affected by depression than any other health condition. And all this is occurring at a time of unprecedented focus on psychiatry and mental health. There are more mental health professionals, psychiatrists and psychologists and social workers, therapists of all kinds, treating more people worldwide than ever before in human history. So why then are we seeing such an increase in mental illness? I mean, why are so many people developing depression if it's just about our family history and our brain physiology and our brain anatomy? And I think it's interesting because the studies show that rates of depression are higher for people who live in industrialized nations as opposed to more developing countries. And then within those developing nations, the rates are higher for people who live in the city as opposed to rural dwellers. And I could probably give an entire separate lecture on all the many things that might contribute to that finding, right? Maybe it's being more sedentary, too much technology, not enough access to green spaces, weakening social bonds, etc. But to me, the point is that this shows us that environmental and lifestyle factors are important in the development and maintenance of mental illness, just as they are in many of the other diseases of affluence, right, that you've heard about today, heart disease and diabetes and cancer. And we've known for a long time that those are tied to lifestyle. So yes, yes, genes and family history and brain physiology, they're all very important when we're treating mental illness. But lifestyle and environmental factors, they can alter our brain function, and they can turn genes on and off. And that's really exciting because it means that we have the power to change our health and the health of our patients or clients. So if lifestyle factors do play such an important role in mental health, then shouldn't we be focusing more on them as part of our intervention and treatment plans? Okay, so you might think it's common sense. Everybody kind of laughed along with me. Of course, what's healthy for the body down here is also healthy for the body up here. But when I was training in psychiatry, which really wasn't that long ago, nobody really talked about that. We've always kind of viewed the brain as being separate from the rest of the body. You know, I'm a psychiatrist. I know you have diabetes, and I know you have heart disease, but I'm not going to talk about that. I'm only going to talk about your depression. But I would challenge my colleagues to say, you're never really going to achieve optimum mental health in your patients if you ignore what's going on in the rest of the body and don't work collaboratively with their other healthcare professionals. So fortunately, we are seeing an increase in research that's looking at the link between quote-unquote mental illness and quote-unquote physical illness. So we use depression as an example again. We know that many chronic illnesses, when you get that diagnosis, it increases your risk for depression. A quarter of patients with cancer develop depression, and we see especially high rates in certain kinds of cancer like breast and pancreatic and colorectal and prostate. About a quarter of patients with diabetes or stroke develop depression, about a third of heart attack survivors, and up to half of those with Parkinson's disease. There's increased rates of depression and obesity, autoimmune diseases, respiratory diseases, neurologic diseases, thyroid disease. Okay, and then on the flip side, so if you develop depression first, well then you have an increased risk of developing many of these chronic illnesses. Obesity, diabetes, cancer, as well up to a twofold increase in the risk for heart disease if you have a diagnosis of depression. Depression is associated with a poorer outcome in those with heart disease, and if you have depression after a heart attack, it triples your risk of dying. Depression is known to increase metabolic symptoms like elevated blood pressure and cholesterol. It increases arteriosclerosis, insulin resistance, and it decreases heart rate variability. And I think that one's really interesting because heart rate variability is a measure of the naturally occurring beat-to-beat variations in your heart rate. And that can actually be seen as a marker of overall health, and it's decreased in depression. We know that depression is linked to an overall higher risk of premature death. So, when you look at all of that data, I would say that it's clear that there's this bi-directional link between mental illness and physical illness. So much so that maybe it doesn't make sense to make a distinction between the two. Maybe it's just health, as opposed to mental health and physical health. But there's been very little focus on what to eat or avoid eating when we're talking about decreasing our risk of mental illness. We talk a lot about it. I've seen the Cheerios commercial. I know I should, eat oats for heart health, but nobody's out there saying what you should eat for mental health. But since we're now seeing that mental illness and physical illness have a bidirectional link, then isn't it safe to say that probably the same foods that are going to be healthy for heart disease and diabetes and cancer are going to be the things we need to eat or avoid eating for mental health? Okay, so we're moving to the second section here. We're going to talk about inflammation because research has shown that inflammation is an important contributor to that bidirectional link that I was talking about. So inflammation is the protective or destructive response of body tissues to irritation or injury. And it's actually the foundation of the body's healing response. So in many cases, inflammation can be a good thing. The problem arises when inflammation stops serving a purpose and becomes chronic, and then it can damage the body and give rise to illness. Right? So an example that a lot of people are aware of is in autoimmune diseases, when the immune system is mistakenly attacking normal tissue, like diabetes, type 1, rheumatoid arthritis, lupus, etc. And inflammation is now a really big topic in medical research, and evidence has shown that chronic inflammation is important in lots of different chronic diseases like we've heard today, as well as psychiatric conditions, mood disorders, anxiety disorders, psychosis. So how does inflammation play a role in mental illness? So one of the many suggested mechanisms is the link of the brain and the immune system and the abnormal production and function of cytokines, right? These small proteins that are important in communication between cells. They have a crucial role in the immune system and in fighting off infection, and they can become dysregulated and harmful in inflammation. And studies have shown that when you take certain cytokines that promote inflammation and you administer them to animals, they start to act in a way that's called sickness behavior. They become listless, they lose interest in eating and grooming and sex. And it's interesting because many of these symptoms are similar to what you actually might see in depression or anxiety. And this sickness behavior is actually thought to be an appropriate adaptive response in an animal when it's sick, right? If you have a cold or the flu, it's a good idea to maybe get your Netflix on and chill for a bit, right? You should avoid socializing because you don't want to spread it to other people. But the problem is when your body is having these inflammatory cytokines and it's telling you that you're sick, so, well, really you should just lie down and not socialize. But actually the treatment for mental illness is to get outside and get some sunshine and be physically active and talk with other people. It's hard to ignore everything that your body is telling you to do. So to me that begs the question, where is all the inflammation coming from? So, as you can see, there's lots of potential sources of inflammation, what we call pro-inflammatory factors. And perhaps not surprisingly, a lot of these are things that you would see more in industrialized nations and more within cities. So if the balance of the pro-inflammatory factors in our lives start to outweigh the anti-inflammatory factors, then our overall inflammatory load can become too high and that can lead to illness. And we have variable amounts of control over different things on this list. I mean, environmental toxins, there's only so much we can do, I guess, sometimes in a day-to-day life. But one area that you can make a lot of change in is what you're putting in your mouth multiple times per day. So, there's already been, other slides kind of alluding to the same fact here, that the top 10 sources of calorie, this is in the US diet, but like we talked about, we're not really all that different here. And if this is the food that we're getting most of our calories from, then how does that kind of diet affect mental health? So one way is because most foods can be considered more or less pro or anti-inflammatory. And the standard American diet is exceedingly high in pro-inflammatory foods. So the goal is to make changes to your diet to increase the anti-inflammatory foods and decrease the pro-inflammatory foods. So usually I'm not a fan of reducing foods to just its major macronutrient, because that's kind of reductionistic, but for clarity, we're going to do just that. So the foods that are most pro-inflammatory, when we're looking at fats, it's going to be the fats that you see in fast food and junk food and processed foods. And we've talked about this already today, the high pro-inflammatory fats, like trans fats and saturated fats. And it's not just the type of fat that's important, but also the ratio, as we heard early, right? If we have too much omega-6 and not enough omega-3, then that's also going to be pro-inflammatory for the body. And then carbohydrates. I mean, probably a lot of people here share my view that carbohydrates have really gotten an unfair rap over the past few years, when it's not the macronutrient carbohydrate that's the problem, it's the refined carbohydrates. They're generally pro-inflammatory because they're high glycemic load foods, which spike blood sugar, cause abnormal reactions that cause pro-inflammatory compounds called advanced glycation end products, which can damage DNA, disrupt cell membranes, advance the aging process. And then protein. In the standard American diet, right, there's a lot of animal products, and especially when the animals have been fed diets that are unnatural to them and grain-rich, that results in the meat being higher in inflammatory fats, like saturated fats. And we know that when you have that kind of diet high in those saturated fats, that can lower levels of something called brain-derived neurotrophic factor, or BDNF for short, which one of the physicians I listened to, he was calling it miracle growth of the brain. Right? So this is something we want to have a lot of in our diet because it can improve mood and attention and learning, and it encourages brain cell growth and lowers brain inflammation. And when you have a diet that's based on nutrient-dense whole foods, that increases your levels of BDNF. And then another reason that meat can be pro-inflammatory is because of a process that happens when meat is cooked. So it's not just important what you eat, it's important how you cook the food that you eat. Because cooking can also cause those advanced glycation end products, which can, as we said, disrupt cell membranes. And so that's one reason that you want to, more often than not, you want to be water sauteing, steaming, baking, as opposed to searing, grilling, and roasting. Better to cook your food at low temperatures over longer time. So the anti-inflammatory foods. This is the good section, because right now I feel like I've killed Christmas and birthdays. So we want to talk about what yummy foods can you eat and be anti-inflammatory. And it's not going to be any surprise. These are the foods that your great-great-grandparents would have recognized as food. A good rule of thumb is that anything that is naturally high in fiber, not fortified with fiber or enriched with fiber, but naturally high in fiber is going to be anti-inflammatory. So all your fruits and vegetables, the natural pigments that color them, they tend to have potent anti-inflammatory properties. And then whole and cracked grains, so whole wheat, brown rice, quinoa, bulgur, millet, barley, buckwheat, sorghum, amaranth, teff, there's a whole lot of them to explore. And when you have the grain either whole or at most in a few large pieces, that's less inflammatory because it causes a gentler rise to the blood sugar. I think a good rule of thumb for something like bread is if you can take it and smush it into a ball in your fist, don't eat it. And then starchy roots and tubers and squashes, emphasizing plant-based proteins, beans, lentils, whole soy foods, right? We want to be avoiding the processed soy as much as possible, and focusing on fats, which are on the balance more anti-inflammatory, right? Like the monounsaturated fatty acids in olives, or the omega-3 fatty acids. And I won't go into that too much because it's been so nicely talked about already. But I will say one thing, because sometimes when we're listening to the few people who do talk about nutrition for mental health, they say, well, fish is very important for mental health. And usually the reason is because of those omega-3 fatty acids. But there's lots of issues that we've heard about environmentally with fish, about the toxins like PCBs and mercury. But also, as was mentioned, fish don't create omega-3 fatty acids. They're not little omega-3 fatty acid producing machines. They get it from the algae that they eat. So, given that a lot of fish these days are farmed fish, and they're fed a very different diet, and therefore no longer a reliable source of omega-3 fatty acids, if you are going to supplement, why don't you just skip the middleman and get your omega-3 fatty acids from the same place that the fish get them? So there are several studies linking low levels of the omega-3 fatty acids EPA and DHA with multiple mental disorders. Depression, postpartum depression, bipolar disorder, ADHD, and psychosis. So we have clinical guidelines in Canada for the treatment of depression, the CanMAC clinical guidelines, and they say that omega-3 fatty acids have level 1 evidence. So that means from large randomized controlled trials with clear-cut results as used for an augmentative therapy in mild to moderate depression. So given this evidence and the fact that there are very few risks to using omega-3 fatty acids, it seems to me to be a pretty underutilized treatment. And talking about oils, I like Thomas Campbell's book, The Campbell Plan. It goes into a really good talk about why oils are not a health-promoting food, why you want to be getting the fats from their original whole source. So I think that's a great discussion. And I like to talk in broad principles because I think it's really easy to get bogged down, small details, the hype around certain foods. But there are some foods that have specific potent anti-inflammatory properties, which helps them be beneficial for mental illness. Specific antioxidants in olives, green tea, and dark chocolate. Some compounds in herbs and spices like ginger and turmeric, especially if you combine the turmeric with black pepper so it's more bioavailable. And cruciferous vegetables, your kale, cauliflower, broccoli, etc. They have potent anti-inflammatory properties. But overall, when we're looking at making the diet more pro-inflammatory, all the main points converge to suggest that following a diet of mainly plants, whole foods, that's likely the best way to maximize physical and mental health. We need a humor break. Okay, so the last section, let food be thy medicine. So we're talking a lot about the contribution to chronic illness, mental illness, and how that's caused by what we eat. But the reality is also that what we don't eat because we're missing out on it, because we're filling up with a lot of pro-inflammatory junk in the standard American diet, that's also important, because it can directly impact our nervous system. And we're going to try to highlight 3 ways. First is your neurotransmitters, right? The chemicals in your body that transmit signals from one brain cell to another. We know that they're important in mental illness. The drugs that we use to treat mental illness, like Prozac, they all focus on these neurotransmitters, but they don't contain the neurotransmitters. They just impact the way your body uses the neurotransmitters. Your body still has to make the neurotransmitters. And so, like, if I was trying to make a table and I didn't have enough wood, it's going to be a wonky looking table. So you have to have enough of the building blocks or the precursors to help your body make the neurotransmitters like serotonin and dopamine and norepinephrine. And even if you have enough of the building blocks, which you're going to get from your healthy plant-based sources of food, you have to have enough of the cofactors. That's like the nails that's putting the wood together. And you get those from, well, lots of different sources, but in the case of serotonin, you would get that from vitamin C as one of the cofactors. So some of the precursors, if we're coming back to serotonin, we know that serotonin comes from the precursor L-tryptophan, and you get L-tryptophan in your diet from things like soybeans, oats, dates, sesame, chickpeas, sunflower seeds. And then, like I said, you want to be getting your precursors or your cofactors, and in this case, vitamin C is a particularly important cofactor. But the role for the precursors and cofactors is the same for all of your neurotransmitters: dopamine, acetylcholine, norepinephrine, all of them. And when we looked at that slide of the list of top 10 food calories consumed, then we can see that it's going to be lacking in a lot of the building blocks and cofactors to make our neurotransmitters. And then when we look at our nerve cells themselves, what we eat helps to create healthy brain cells. So one reason comes us back to the omega-3 fatty acids. We know they play an important role in brain cell integrity, healthy development, maintenance, and function of our brain cells, particularly because they contribute to the cell's membrane or outer layer. And that may be another reason why omega-3 fatty acids lower the risk of depression, play a role in brain development in infants and children, and they contribute to successful brain aging. And another factor for our neurons are antioxidants, because they inhibit oxidation reactions or oxidative stress, which can damage our cells, including our brain cells. So you want to be consuming antioxidants like vitamin C, vitamin E, beta-carotene, and selenium, because that's going to keep the oxidation reactions in check, thereby reducing unnecessary cell death or cell damage. And antioxidants, plentiful in fruits and vegetables, whole grains, legumes, nuts, etc. And the last point is about the microbiome, which we've heard about a lot today too. There's a lot of attention being paid to the gut microbiome, the collective term for all the microbes, bacteria, fungi, protozoa, viruses that live inside or on the human body. And 9 out of every 10 cells in our body actually belongs to microbial species. And we generally regard microbes as either harmful and disease-causing, or at best harmless, but what we're finding is that it's actually equally true that those that are on or in our body play an important role in keeping us healthy. And the problem is that the standard American diet, it might feed the human, albeit not very well, but it doesn't feed the microbiome. So gut dysfunction due to an unhealthy microbiome has been implicated as one of the prime causes of that widespread chronic inflammation we talked about, and this could lead to depression and anxiety. And the gut has its own nervous system called the second brain, or the enteric nervous system, and it uses all the same neurotransmitters that we talked about earlier. And if the gut microbiome becomes unhealthy, then this could negatively affect the enteric nervous system and the gut-brain axis, which is the biochemical signaling that takes place between the gastrointestinal tract and the nervous system. And it's interesting to note that there's often a lot of gut symptoms in mental illness, right? Decreased appetite, abdominal distress, changes in bowel habits. And there's now evidence that pre- and probiotics can be beneficial for both the gut symptoms and the emotional symptoms of these illnesses. They can also alter levels of neurotransmitters and lower our overall levels of stress. So what to make of this? I think the research is still evolving. But one thing that I think has been really exciting to see is that you can actually improve your microbiome even without taking probiotics, that just eating a very whole food plant-based diet has been shown that it can actually improve the microbiome itself. Okay, one more funny. Okay, so just a few last points. I know I'm running out of time. This is a former US food guide. And there are lots of things we could note about it, but in particular, I want you to look at group 7. Yes, that's right. Butter was its own food group. Amazing. But in addition, there's a line on the bottom that says, in addition to the basic 7, eat any other foods you want. This was the food guide. But this was produced during the war, when just getting enough calories to survive the war was of primary importance, not your risk for chronic disease. You just got to survive the war. But what that illustrates to me is that dietary recommendations change and food fads come in and out of favor, and that can be one reason why we and our patients may be so confused about what we should eat. And so I like to point people to let's look at what are the basic principles that have been seen in most cultures in the world over most of human history, and that's eating whole, unprocessed foods and focusing on plants. And the goal isn't to turn you all into nutrition experts, but rather to make you aware that nutrition is important in mental illness and mental health. And that's why, in my opinion, a dietary history should be part of a mental health history, and why nutritional intervention should be part of a comprehensive psychiatric treatment plan. So the last slide, I promise, the same diet that promotes physical wellness also promotes mental wellness, and now you all know why. We want to minimize pro-inflammatory foods and emphasize anti-inflammatory foods. A plant-based diet of whole, unprocessed foods provide the building blocks for healthy neurotransmitters, healthy brain cells, and healthy microbiome, and that the general principles are going to be the most important. We don't have to worry about, really, is kale superior to spinach, and am I getting enough goji berries? Just eating a whole plant food diet. So I would say that eating this way is anti-inflammatory, decreases your risk for chronic illness, promotes mental health. So maybe an apple a day really can keep the doctor away. Thank you.